Hi there. My name is AJ Cipperly, and I've been supporting people living with dementia and their families for over 20 years. I currently serve as the Vice President of Memory Care for the Arbor Company, based out of Atlanta, Georgia. In my current role, as well as my past similar roles, I work with family and professional caregivers to help them better understand the journey of dementia and become better support partners for the people they're caring for. I also worked for the Alzheimer's Association, where I provided family counseling and public education about cognitive impairment and dementia. Through the years of my career working with both families and professionals, one of the questions I get asked the most is, how do I know if the person I'm caring for is experiencing dementia or not? Or another common question, what's normal aging and what's dementia? And sometimes it's simply, what is the difference between Alzheimer's and dementia? I've heard both words, but I don't know if they're the same or different. My goal is to help you better understand the answers to some of these questions and provide you with some support in your journey. Maybe you have an older parent or relative that you're concerned about. Maybe it's a spouse that you've noticed changes in and you're not sure if it's normal or not. Maybe it's a friend or a neighbor that's experiencing some cognitive changes and you're trying to learn more so you can help. First of all, your relative, spouse, friend, or neighbor is very fortunate to have you. So thank you for being that caring person and for seeking out more knowledge for yourself and for them. Let's talk about and define the words we'll be using. When discussing this topic, I use the phrase normal aging versus not normal aging. Instead of saying what's normal aging and what's dementia, because something just might not be normal or normal aging doesn't mean it's dementia. So what is dementia then? The term dementia refers to a group of symptoms that impacts cognitive function. These might include problems with memory, challenges in using good judgment, or being able to make logical and rational decisions. And these challenges are significant enough to impact the person's daily life. When someone is experiencing dementia symptoms, it's important to identify what's causing those symptoms. Just like a fever is a symptom of an infection in the body, dementia is a symptom that something is causing. Alzheimer's is a cause or type of dementia. It's the most common and the one that most of us are familiar with. But there's also vascular dementia, Lewy body dementia, and frontal lobe dementias, among many more. Dementia is not a normal part of aging. We used to think it was. Maybe you remember when getting older was called senility, or he's experiencing hardening of the arteries. It was considered part of the aging process when an older adult would start to behave differently and experience some of these memory challenges. Well, we've come a long way, and now we know that dementia is not part of the normal aging process. The cause, it could be an infection in the body. Older adults experience infections differently. Having a urinary tract or kidney infection can cause significant cognitive challenges, confusion, agitation, even anxiety. Identifying this infection and treating it can often resolve those cognitive symptoms. Medications can cause cognitive challenges, especially if two medications aren't interacting well with one another. Depression can even cause a person to have dementia-like symptoms, trouble with their memory, confusion, and even personality changes. Sleep disturbances or disorders, like sleep apnea, can cause a person to have cognitive difficulties, problems with their thinking and memory. All the examples I just gave, depression, medication interactions, infections, sleep disturbances, all of those can be treated, often leading to a resolution of the cognitive impairment. But it's important to recognize that these cognitive challenges weren't normal. They weren't just due to the normal aging process. So here we are back at normal versus not normal. We know that there is a normal aging process. Our brain ages just like our body. And just like there are ways to help our bodies age well, there are most certainly ways we can help our brains age well too. But that's a topic for another day. As we age, it's normal for us not to be able to hold on to as much information as we used to. We can still learn and process the information. It may just take us longer, or we might have to use different strategies to help us remember. How many of us use notes, lists, and reminders, whether it's handwritten notes or using our phones or other devices to remind us of things? As we age, we may find that we need to do more than that than we used to. It's also not so much about holding on to the information as much as it is also being able to recall it and the time it takes to do so. Our recall isn't as good as we get older. We have so much more data in our brains to sort through. Think of the thousands and millions of people you've met over the course of your life. When you see someone you know but can't remember their name, your brain is having to go through all those images and names to find the right one. Sometimes we're successful, and sometimes we're not. Sometimes we need more information to help us access the right name. Maybe it's my daughter's friend that I met in Rochester when I visited her a few years ago. That's right, Betty. Her name is Betty. So it's not that the information isn't there, it just takes me more time or I need more cues to help me find it. So it's normal to forget some things, remembers people's names. If we don't have good memory strategies like notes or reminders, we may find ourselves missing appointments or forgetting things on our grocery list. How many of us have ever left the oven or stove on? How many of us purchase automatic shut-off curling irons or clothing irons so we don't have to worry if we've left it on or not? The fact is, we have a lot going on in our lives, hence, a lot going on in our brains. We've all been so distracted that we've forgotten something, whether it's turning off the oven or the iron. And while that's certainly a safety concern and one that should cause us to practice some more mindfulness in our lives, it is pretty normal in our world today. How many of us have misplaced our keys and frantically searched everywhere, only to find them in a place that we don't normally keep them? That's normal. But if I'm placing my keys in a very unusual place, maybe my keys, I find them in the microwave or in the refrigerator, that's not as normal, is it? And when that forgetting starts to get so frequent that it's impacting our daily life, so maybe you're late to work for the seventh time because you had to go back and check if you turned off the curling iron. The first two times the stove was left on, you caught it. But the third time, the pot burnt up and you only noticed when you started smelling something burning. Well, that's starting to be not normal. Notice that I did not say dementia, but something is going on and you should want to try and figure it out. So maybe you're concerned about your mom or your dad because they keep telling the same stories over and over, or may ask you the same question a few times in a row. And while repeated questions or stories certainly can be a part of dementia and something to explore and get curious about, it's really the intensity and impact with which the memory problems are showing up. Is your parent concerned about their memory? Do they make comments to you that indicate they've noticed changes and are worried? Well, that's definitely an opportunity for you to lean in and learn more. Mom, you mentioned your memory twice yesterday, and it seems like it's bothering you. Tell me more. Or maybe they're not mentioning it. You're noticing it, and it definitely seems to be different than usual. Again, get curious. See if there's other signs that may not be as evident. Does mom seem to be getting out as much as she used to? Maybe she's always been very social and active all her life, but now you notice she's not talking about her friends or her social activities anymore. So ask, hey mom, how's the garden club going? Are you still meeting every month and getting ready to do that big fundraiser for the holidays? She may tell you that she hasn't attended in a while, or that she gave up being president of the club because she served many years and it was time for her to quit. What does the house look like? Did she always keep a neat and orderly home? And now, is it much less neat and orderly? Have there been accidents with the car, either that she's told you about, or maybe you see the scratches and dents in the car? Maybe there's lots of old and expired food in the fridge. Bill collection or late payment notices in the mail are lying around the house. While all of these things in and of themselves may not be a warning sign, they are clues, and added together with some other things you may be hearing or noticing, they certainly could be indications that there's something going on, and getting a good workup by a doctor may be a good idea. Think about intensity and impact. If my memory loss is so significant that I'm not taking my medications because I either forgot to or I keep forgetting to pick them up from the pharmacy, well, depending on those medications, that could have incredibly bad outcomes. If I'm getting in the car and getting lost when I go to very familiar places, or I'm not able to find my way home, that's also pretty significant and very much not normal. Falling for scams or giving away large sums of money to my own financial detriment, also significant and not normal. Also, it's important to think about how and who I've been historically. If I've always struggled with managing my money, maybe my husband always manages the finances, and now he's passed away, and I've had to learn how to do that all over again later in life. I was never good at it, so I'm probably still not going to be good at it at an older age. So if I bounce some checks or miss some payments, that for me may be normal. Maybe your friend has always been the best cook. She cooked dinner for her family every night while her kids were growing up, and has even published a cookbook with all of her favorite recipes. But now you're noticing she's having trouble following the steps in the recipe. She's stopped hosting the potlucks, and the last few dishes she's made for you just haven't been good. These may be some signs that something is not normal. Or maybe your friend has always taken great pride and care in her appearance, and now you're starting to notice that she's looking a little less put together than usual, wearing the same clothes for days in a row, or not looking as if she's been brushing or maybe even washing her hair. I hope I've given you some good examples of normal and not normal, and that when and if you have concerns about the person that you care about, that you'll do one thing: get curious, lean in, and try to learn more. Encourage the person to get checked out by a physician. Remember, not normal doesn't automatically mean dementia, and it doesn't automatically mean Alzheimer's. And if it does end up being a dementia, now you and your loved one are armed with two very critical tools: knowledge and control. Thank you for watching and for your desire to learn more about this important topic.